Good afternoon. Thanks for joining us here today. Thanks as well to Dr. Brent Roussin for joining me here. Brent, thanks for all your work. Appreciate it. This week is National Immunization Awareness Week. It's a week held annually to highlight and recognize the importance of vaccines. I can't think of a more appropriate year for us to recognize this week and to recognize also the impact that immunization has in protecting and saving lives. This is an important campaign each and every year, but never have vaccines been more important and more top of mind than they are right now. Today we're engaged in the largest vaccination campaign in Manitoba's history, and I'm sure in the history of Canada as well. And I want to commend Manitoba's Vaccine Implementation Task Force for their efforts. It's a team of very, very dedicated staff and volunteers. They deserve and appreciate a word of encouragement. They're facing up to a challenge that's unprecedented, and they are undertaking this monumental challenge in order to provide life-saving vaccines to as many Manitobans as quickly and as safely as possible. We need all Manitobans to join the team. The best COVID vaccine is the first one available, and I continue to encourage all Manitobans roll up their sleeve as soon as they are eligible. Le meilleur vaccin COVID est la première disponible. Et je continue d'encourager tous les Manitobans à se faire vacciner dès qu'ils sont admissibles. The third wave of the pandemic is here. It's a race between variants and vaccines, and right now, in most of our country, the variants are winning. We can do something about that, though, and we have started 1 week ago to strengthen new public health orders. Dr. Roussin and I introduced those in order to address and slow the speed of this third wave and to avoid, as best we possibly can, a return to a full shutdown of sectors of our economy and of our lives, as that has major consequences for many financially and, of course, to the mental health of many people who we care for. Those measures were put in place in order to limit gatherings and close contacts, particularly indoors, in order to strengthen the issue of reducing transmission rates, which have been increasing in recent weeks. And this is especially important with the variants of concern, of course, because they have the more rapid ability to affect others. Despite our best collective efforts, and in spite of the fact that we have maintained throughout this entire pandemic some of the most strict public health orders in Canada, Manitoba's case numbers, our test positivity rates have been rising, and our hospitalizations have been going up somewhat as well. That threatens the ability of our healthcare system, should that be allowed to continue, to care for those most in need, not only those that have COVID, but for other afflictions and ailments as well. So we're at a very critical point now, not without precedent. We've faced these challenges before, and we're going to need to recognize that we have to face them again. The variants of concern add a dimension that wasn't here in the past, but the fundamentals remain the same. And the fundamentals that we have to follow are, of course, the ones we keep repeating, of social distancing, of making sure that we mask up, of avoiding indoor confined spaces, and so on, of washing our hands, being careful. When people forget those fundamentals, that's when we begin to have additional problems, and it's clear that some Manitobans have forgotten about those fundamentals, and as a consequence, we are where we are. To all Manitobans, I say this today: stay at home if you can, significantly limit your close contacts, and get your vaccine as soon as you are eligible to get it. So today, Dr. Roussin and I are here to announce new public health measures that we believe will, in some weeks' time, dampen the third wave so that we can continue to protect and safeguard Manitoba lives. Now, we've done this before. If you look at the graphs that are available on every other province's behaviors in terms of performance of cases, hospitalizations, intensive care occupancy, you'll note that Manitoba was, west of the Maritimes in our country, the best at bending the curve. And that's thanks to not just strict public health measures, but the fact that Manitobans abided by those measures. That is the key to making these measures work. They can exist on a piece of paper, but if people won't follow them, then they won't be effective. We need them to be effective now. We need Manitobans to embrace the challenge that they've embraced in the past again. These measures are going to be, that Brent will announce shortly, are going to be in effect for 4 weeks. That will take us past the May long weekend, which is obviously a pretty traditional time that people like to get together, and it will be bad news for some, but necessary and understandable, I think, for all of us, that these are measures that have to extend past that May long weekend. That is the unofficial start to summer. We'll delay that unofficial start just a little bit for sure. We need Manitobans to stay home now. We need to help flatten this third wave curve so we can enjoy all that Manitoba summers have to offer. Nous avons besoin que les Manitobains restent à la maison maintenant. Aplatisons le curbe de cette troisième vague. Excuse me. Afin que nous puissions profiter de tout ce que nos étés Manitobains ont à offrir. I'll now pass it over to Dr. Roussin to expand on these new measures. Brent, over to you.
Thank you, Premier. Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. In March and early April, we worked hard to reduce our COVID case count. The variants of concerns that have emerged have largely changed those rules. I want to share a graphic with you now. This graphic is showing how fast our case numbers have increased. We're seeing seeing the number of new infections climb, and the 7-day average is following quickly behind. Right now, we're essentially where we're at the end of October, right before we saw that dramatic increase in cases. To add to that, we're now dealing with the majority of our cases being variants of concern, which are much more transmissible. They spread easy, and so we're in a very precarious place right now. The average age of COVID-19 cases in our ICUs is at 56, and so that's significantly younger than it was last fall. Cases are increasing in most age groups, but are rapidly advancing in those in their 20s and 30s. Since last Friday, we've announced more than 700 cases. The majority of these cases are in Winnipeg, but we see case numbers rising in all regions. Hospitalizations from last week are up 56%. We're seeing similar trends throughout the world. We can see what's occurring right now, unfortunately, in India, and we see in other parts of Canada, rapid case numbers climbing, as well as hospitalizations and ICU numbers. So last week we announced changes to the orders to try to help slow the spread of this third wave and to try to help avoid another full lockdown of services. Today we're going to have to make additional orders to dampen the spread of that third wave. The following additional public health order restrictions will be in effect Wednesday, April 28 at 12:01 a.m. No visitors will be allowed at private residences, either indoors or outdoors, with certain exceptions, including allowing one visitor for people who live alone. No indoor gatherings will be permitted, and outdoor gatherings of up to 10 persons will be allowed in public outdoor spaces only. Cultural and faith-based gatherings will be limited to 25% capacity or a maximum of 10 people, whichever is lower, and indoor mask use is required at all times. Patio dining will be restricted to groups of 4 people only, with no household limitations, though, in that group of 4. Food courts in malls and shopping centers will be required to close. Gyms and fitness centers are going to continue to be limited to 25% capacity, but with the additional requirement of having 3 meters of physical distancing between patrons. Spectators at outdoor sports and recreation facilities will be limited to 1 parent or caregiver per youth, and physical distancing at 2 meters must be maintained. Dance, theater, and music schools will continue to be limited to 25% capacity. The new orders will limit the number of people on site to 10, with one parent or caregiver or spectator per youth participant. But again, physical distancing of 2 meters must be maintained. Personal services will continue to be able to operate at 50% capacity, but appointments will be required. Day camps will be permitted to have up to 10 children, and that's both indoors or outdoors. Retail stores are limited to 25% capacity with a cap of 250 patrons, whichever is lower. Malls will be limited to 25% of their facilities capacity. So these public health orders are set the foundation for our action to reduce the amount of contacts we have outside of our household. But public health orders cannot do this alone. We need Manitobans to understand how critical we are right now in a race between vaccinations and the variants of concern. And really this means staying home as much as possible. That's the best way to reduce the amount of contacts you have outside of your household. When you do leave your household, wearing masks when you're around people from outside of our household. I'm calling on businesses and organizational leaders to help ensure people are staying apart in their facilities. Encourage your employees to stay home if they're sick and isolate if they are close contact to a case. The vaccine is giving us that optimistic look to the future, but we're not there yet with the amount of population uptake of that vaccine. We're still a ways away before we have enough of our population vaccinated. There are many Manitobans who have not received vaccine dose as of yet. It's up to all of us to take these proactive measures to protect each other, protect our loved ones, our family, our friends, our community. As we continue to roll out our vaccine, we'll be able to once again look at loosening these restrictions. But right now, please stay home as much as possible. Please reduce the amount of contacts you have outside of your household. Isolate if you or someone else in your household is sick. We've seen these very preventable transmission chains many times, where an individual within a household is clearly ill. They do not go for testing, but everyone else in that household continues about their business, going to work, going to school, and outbreaks ensue. This could have been prevented with people getting tested as soon as possible and everyone within that household isolating pending results. Over the next the 4 weeks of these orders, we expect more than 300,000 vaccines will be administered. And so this is important. In these 4 weeks, we can vaccinate another 300,000 Manitobans. So if we all do our part, this very well could be our last strict orders. May long weekends, that unofficial start to summer. Right now, the orders are in place until May 26th, which is after that long weekend. But if we do our part, bring down these case numbers, it is possible to save that long weekend. Staying home and doing our part for the next 4 weeks will put us in the best chance to have a very good summer here. Need to buckle down now, stop this spread. So thanks again to all Manitobans, and I'm going to pass it back over to the Premier.
Thanks very much, Dr. Roussin. Our number one priority in this pandemic has been and is going to continue to be protecting our most vulnerable Manitobans and ensuring our healthcare system has the capacity it needs to care for all Manitobans when they need that care. I know that today's news will be disappointing, especially to those who have done their very, very best to abide by these public health orders and have made so many sacrifices throughout this pandemic. And I thank them, and I thank all Manitobans for abiding by these public health orders. As we move forward, it's critical that you do. As a government, we continue to take a thoughtful and balanced approach based on the health expertise that we have and the benefit of having some tremendous people dedicated, like Dr. Roussin, dedicated to the cause of protecting our public safety. We take into consideration everyone's perspectives. We have perspectives that are many and varied, because Manitobans are thinking people and we don't agree on everything. But when we come to a conclusion on public health order, we expect everyone to abide by those public health orders, because it's in the public interest that you do. En tant que gouvernement, nous continuons d'adopter une approche équilibrée pour protéger la santé et le bien-être personnel et financier aussi de tous les Manitobains. Recognize that for some people they've been saying there should be no restrictions. For other people they've been saying there should be no economy and no social life at all. These perspectives are honest perspectives. That doesn't give them validity. The reality is there are consequences for everything we do. And the consequences of not abiding by public health orders are real, and you're seeing them now. We need to follow the public health orders. We need to follow the science. We need to follow the advice of our public health experts, because not doing so has real consequences. And we know that if we do follow those public health orders, we can achieve what we've achieved already this year by bending the COVID curve down and moving ourselves out of the second wave demonstrably successfully. We need to do that now with this third wave as well. We recognize that many Manitobans are struggling right now on both sides of the spectrum, from COVID fatigue to economic fatigue, the fear of the unknown, the fear of the variants themselves and their seeming ability to evolve to be even more devious than they have been in the past. It's time to call upon that Manitoba spirit we know we have, of compassion and determination and of teamwork, and beat COVID back. The same spirit that beat COVID back these past few months is the spirit that we need now to keep COVID at bay again. We're going to have a few tough weeks ahead of us. Expect these numbers to rise most certainly over the next few weeks. And realize that we can begin now, because the consequences of following the health orders will be positive, to bend the COVID curve for the weeks thereafter. It's that foresight that you must have in order to make the sacrifices necessary to achieve these positive changes that we've achieved in the past, and we can again. We need to do everything we can to change the outcome of this race. We're losing the race because vaccines are not here in sufficient numbers yet. That's been a problem throughout this pandemic. It appears it will continue to be a problem for a while yet. So while we are continuing here in Manitoba and across the country to ramp up our planned vaccine efforts as more vaccines become available from the federal government, we continue to bolster our enforcement efforts as well to target the high-risk areas and activities. More inspections, more visibility, more boots on the ground. Our enforcement will be enhanced in key sectors, including retail and big box stores, patios and restaurants, recreation events, and we'll be including additional surveillance on self-isolation requirements to ensure they're followed as well. In Manitoba, we've maintained some of the strictest public health measures in the country for many months now. We have had a very, very careful and a cautious reopening, more so than many other provinces. And we've kept stringent public health measures in place, which we are strengthening today again. But we've done that because they work. But they don't work by themselves. They only work if Manitobans make them work. And so I say thanks again to Manitobans for making them work. We need to do that again. These measures have saved thousands of lives. And we all have a role to play in protecting ourselves, our families, our loved ones, and our healthcare system too. So the level of caution needs to remain very, very high. Stick to the fundamentals. Limit your risks. Avoid close contact settings, crowded places, closed spaces. Wash your hands. As Dr. Roussin has said repeatedly, stay home. When you or any member of your family is ill, wear a mask. Limit your close contacts. Stay positive. Be kind. We can beat this thing together. Thank you. Look forward to your questions.
Thank you, Mr. Premier. Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon, from the Brandon Sun, Kimberly.
Thank you. Good afternoon. If the province is doing everything it can to protect Manitobans, why are the borders still open?
So, well, I mean, certainly the risk of the importation of the virus, and especially the variants, we've known this, and that's why Manitoba was, for the longest period of time, the only province outside of the Maritimes that had any travel restrictions in place. So anyone entering Manitoba, with few exceptions, are required to isolate for 14 days. So we've had that in place for the longest and essentially exclusive to most of the provinces. So we're going to continue to do that. We want to ensure that anyone entering Manitoba does isolate for 14 days. It's the best way that we keep those variants from being reintroduced.
Thank you. If the province is imposing more restrictions, will there be a regional approach to it?
Nothing's ever off the table. We'll always look at that, but right now we see increasing cases in all regions, and we see a lot of mobility between regions. And so the target approach just isn't feasible right now at this point.
From CJOB, Schuyler.
Thank you for your time today, you two. You spoke about ramping up enforcement measures, and at the same time, we're enacting, some of the strictest restrictions when it comes to visiting family and friends, which is basically now impossible except for some single people. Yet, nearly 1,000 people gathered at the Forks yesterday, and enforcement was largely not there. I saw it with my own two eyes. So, how do you expect Manitobans to follow these orders? When, in a very visible situation, that wasn't happening just a day ago?
Well, Schuyler, I understand tickets were issued. I'll have to wait till tomorrow to get detail from the officials as to how many. But I agree that enforcement's a concern, and I agree very much that we need to step it up. So I've made that position clear, and we'll be looking at additional enforcement in malls, in big box stores, as well as at recreational events. Most certainly at these types of events like the one at the Forks yesterday, there has to be enforcement there. We've seen violations of public health orders too many times, and there need to be consequences there because most of us are doing the right things, and we need all of us to do the right things.
Appreciate your answer. In January, we decided to not send our kids back to school for some time. In the span of 4 or 5 weeks, we ended up being able to loosen restrictions. Why wasn't that consideration taken into account this time?
Yeah, well, it's certainly considered, like, all approaches. We consider every aspect of it. We see the rapid case numbers growing in those younger cohorts. We're not seeing a lot of transmission within schools. It's occurring outside of schools. And then that's always been our priority, to be able to keep the kids in school. And so we're going to continue to try to do that. Obviously, we're watching things very closely. But right now, we haven't just seen a lot of that transmission within schools. It's the things happening outside of schools.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. I guess for Premier, you blame the vaccine shortage, you blame Manitobans for having to enact this stuff now and in the past. I guess I'm wondering, how did we get here to today? You guys would have had modeling to suggest where we would be at. We know that it only takes a few people to ruin it for many. We saw that in the second wave. So I guess my question is, why weren't more steps taken earlier?
Well, Scott, I can only say I'm not going to blame somebody from BC or Ontario if Manitobans are giving each other COVID, so let's be clear about that and frank about it. The public health orders are for Manitobans, where they apply to Manitobans and they apply to visitors who come here. And we've maintained some of the most strict public health rules throughout this entire pandemic. We loosened them gradually at the outset, slower than other provinces, and now we're bringing back restrictions which actually pass other provinces that have much more significant statistical impact of COVID at this time in their hospitals, with their ICUs, and in terms of overall numbers than Manitoba does. But we're going in the wrong direction, and so we need to get out in this and do a better job of enforcement and do a better job of getting the message out. I see and I compliment those community members and agencies and individuals, MLAs, who've been out encouraging vaccines to be administered. encouraging people to get their vaccines, that's going to help. But we can't let our guard down, and there's a danger. We got a third of the province approximately that's got vaccines. I've been saying repeatedly, don't let your guard down because you got a first vaccine. That's not smart. And so, we've got to be diligent. We've got to keep playing defense as we move forward here. And I think these numbers prove that these measures are necessary. And of course, they take time to work. We all know that. But we've done this before, and we need to do it again now.
I guess what I meant was, why aren't you guys looking in the mirror? But anyways, my second question, Premier, you're on record saying that you didn't do enough enforcement during the second wave. It's obviously not the case again. Why hasn't that been ramped up since last time?
Well, it was ramped up significantly, and I look in the mirror every day. It's not that pleasant, but I do it. And I look at myself as being responsible for every failure, and I look at Manitobans as being responsible for every success. So I'll keep doing that. And I'll tell you what, we're acting proactively. When you do a comparison of other jurisdictions, you'd know that, and you'd know that we've stepped up on enforcement significantly, not just after the second wave, actually before it, so that we had the ability, and Manitobans, I think, did a great job, but I think our enforcement measures really helped to make sure that we got the message out there. We're serious about this, and we need to do it again now. Need to step it up again now because clearly it's not working 100% effectively when you're seeing the numbers that we're seeing, and you're hearing reports like Dr. Atwal said recently that he's hearing about increased numbers of gatherings exceeding the limits and things like that. That we need to step up again, and we got to step up harder. More boots on the ground, better oversight, better enforcement.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. This question's for you. I'm wondering if you can explain in what way your data on the manner the virus is spreading support these specific new measures that you announced today. Is it that the majority of cases are coming from household gatherings like this? So I was wondering if you could speak to that.
Yeah, so we certainly see a lot of transmission in household gatherings and a lot of transmission in gatherings that are not consistent with the orders. So that was a major concern with us. We, of course, see a lot of community transmission as well, meaning we can't link it up with a transmission chain. So we have to focus on places where we know transmission occurs. Prolonged indoor contact is the most important areas. And then outdoor gatherings are much less risky, not without risk, but we really want that message to be for Manitobans to stay home as much as possible. If you're going out, spend that time outdoors, but always remember those fundamentals: washing your hands, masking, distancing, and then most importantly is to just to stay home when ill, and stay home when anyone in your family is ill, pending a result. We can't stress it enough. There's been, unfortunately, so much transmission that could have been avoided if that advice had been followed.
You just indicated in one of your earlier answers that there's already gathering above the limit from the province. I'm wondering how you're going to get people aren't following the rules now. How are you going to convince them to follow these new rules that are even more stringent? Is there going to be any sort of enforcement of private gathering limits?
Well, certainly enforcement is an option, and it will be utilized where appropriate. A lot of it is coming with the messaging and just what's about the critical nature of where we are, and it's why we've limited gatherings even outdoors in public residences, because it should be very unusual to see cars and people coming over to people's private residence. There's only a few exceptions for that. So we don't want that to occur outdoors or indoors. And so it should be unusual to see gatherings at people's houses. So we just need to message how important this is right now for people to stay home, limit their contacts outside of their household, and just this isn't a time to gather with other households.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. We're told that you shared on a call with doctors on Thursday the presence of the Indian variant in Manitoba. Can you confirm that variant and give us whatever information you can about that case?
A number of our sequencing is still out. We had early indications late last week that we may have the Indian variant related to international travel. But we don't have any confirmation on that at this point. So we're still pending on it. As we followed up on it, we still haven't had any confirmation on it. Like really any of the variants right now, or actually any of the cases right now, we're treating them all as if they're variants of concern. And so everything is being done right now as if that was a variant of concern, but I don't have any confirmation on that.
Thank you very much for that. And both for you and for Mr. Premier, the province is largely on the same exponential growth today as it was 3 weeks ago. Granted, it's sped up in the past week to about 63%, but you can see that curve for 3 weeks. So the question is, what's the scientific reason that we didn't see these restrictions 3 weeks ago?
Yeah, well, I mean, the thing with these are the trend is always changing, right? So we know that this third wave is coming our way. We've held it off a lot longer than what we've seen in other jurisdictions. And so we always are going to take that least restrictive means. We're going to watch the numbers. We need Manitobans on board for this. And I think that's a challenge. We've seen a number of issues right now with trying to get Manitobans to continue to follow these orders. It's been, over a year. People are tired, and so we're going to take that approach, that balanced approach, that we take a number of things in consideration. So, we see that trajectory now, and now we need to act on it. Acting before is tough to know because we don't know exactly when that trajectory is going to start going up. Then we'll have restrictions in place that are not the least restrictive. We'll be restricting when our case numbers are low. So it's a challenge to find that balance.
It's hard to make rules based on hindsight because we don't have that much hindsight when it comes to these charts that you just referred to. They're historical data that wasn't available to us 3 weeks ago, obviously.
From the Canadian Press, Steve.
Hi there. Premier, you mentioned tougher enforcement. I'm wondering if you could be specific, because there are many Manitobans who have followed the rules, who've done everything they can, and they see a minority of people flouting the rules almost continuously. So what specifically will be done to ensure that health orders are followed?
Well, 2 points. I think that observation is one that I share. I'm very concerned that we have a minority of people that are flouting public health orders again, and that has happened at various points throughout this pandemic, and we've endeavored to beef up enforcement on several occasions. Now we need to target it to those areas where we know there are higher incidences of COVID outbreaks, and that I don't do the enforcement. The justice officials are responsible for overseeing that. I won't say too much about the specifics because that would make the enforcement less effective, but I do think it's important that it be made more effective.
And Dr. Roussin, many of these new public health orders, the changes today, look very much targeted to that close, prolonged indoor contact. The household gatherings and the religious services, that sort of thing. I'm wondering why you've cut the capacity at retail, given that, as far as I know, there hasn't been a significant spread of COVID-19 in the retail sector, and it's not that sort of prolonged contact that you get from, say, a social gathering.
Yeah, and so it is a lower risk than the prolonged indoor contact that we see with some of the other things, households or other gatherings. But it's certainly not without risk. But you see that we've cut the cap, so we still have the 25% capacity limit similar to other places. The cap is still relatively large for the big, larger areas at 250. It's just one of those things that we've continually seen and heard of reports where these places are looking crowded. And so, yes, it's a bit lower of a risk, but it's still not without risk. And we need to get that message out that we are not back at normal. So going out with the family for a shopping day isn't where we're at right now. It's go out if you need something essential. Take as few people from your household as possible, get what you need, and back home. And so this is all part of that messaging.
From CTV Winnipeg, Jeff.
Oh, hi. I'm just wondering. You're limiting some things. Food courts are being closed. Was there any consideration, or is there any consideration to the indoor, sports, dance? Why keep those open?
Well, this is that balance. Right? So we know that there's a lot of benefit, especially with our youth, getting active, participating in these things. It's not without risk. We see transmission at these events, but we know there's so much benefit, mental health, physical health, to try to keep these going. So it's all part of this balance. Now, we offset some of that risk by making these restrictions on spectators. So we want those kids to benefit from the physical activity and the playing these games, but we offset it as, well, maybe we don't need large amounts of spectators right now. Let's let the kids benefit, everyone else stand back, but this is that whole thing about that balance.
I know you've already addressed the school question again, but I do want to ask it a bit differently. What we are seeing, obviously, some schools or just cohorts going to remote learning because of outbreaks. We're at, I think, we're at over 8% for a test positivity rate in Winnipeg. When do we have no choice but to go to remote learning province-wide, or do we not because we didn't do it in the second wave?
Yeah, so we don't have certainly one indicator that flags it for us that we're going to do that. I think that as we see more and more transmission occurring in those younger age groups, you're going to see more and more people, more and more cohorts, and possibly schools, if there's a number of contacts within them, going to remote learning for that period of time. We're going to try to keep the kids in school as long as we can, as long as we consider it safe, but we'll do our typical contact investigations within these things, and so you expect a number of cohorts requiring that isolation. And really, a lot of that message is that this transmission isn't occurring in schools. It's occurring with the youth gathering outside of schools, house parties, sleepovers. So we're really stressing to parents that if we're trying to keep these kids in school, we have to limit the amount of gathering that they have outside of school. That's where we're seeing that transmission.
From City News, Jonas.
Good afternoon, folks. Dr. Roussin, if I could just maybe dive into the timing of restrictions and when they come in and the impacts we are now seeing on the health system versus the least restrictive means. Maybe just walk us through so it's clear to everybody how your decision-making works with it.
Yeah, so I think that the biggest thing is that there's a balance. That these restrictions, we know, and Manitobans know, they have adverse outcomes with them as well. So it's not simply about how strict can we make things to only focus on COVID. There are health effects with the restrictions. So we need to find that balance. And so as we saw our second wave coming down, we saw the strain on our healthcare system improving. It put us in a position to cautiously start reopening things. That has benefits on health, all aspects of health. As we continue to loosen them, we followed the cases closely. We really did everything we could with those restrictions to try not to have to go backwards, but we could see over time case numbers increasing, and then we had to make that difficult decision last time to go backwards and start restricting things again. And then now as we see this trajectory, we're right back to where we were in October and November, so we have to make that more difficult decision to even restrict further. So it's always that balance. We can't look at this only as counting COVID. There are other health things at play. Right now, when we see this trajectory, we know that that balance has swung to bringing down COVID case numbers.
Thank you, Fetzer. And just as a follow-up, going back again to schools, we've seen a lot of teachers this past week, the last 2 weeks, they're getting to the point where they're scared to be in school. Maybe just a message to them, to folks that are scared, that have parents or kids that are in schools. I guess just maybe something to reassure them that, they are being watched out for.
Yeah, I mean, I think that would be my first message to teachers is thank you. Having the schools in session during most of this the second and third wave has kept that at least some semblance of normalcy for our youth, and has a tremendous impact on their physical and mental health. So thanks for all of your work on this. And again, because of that tremendous work of our educational sector, the teachers, all the administrators, we've seen not a lot of transmission within schools, despite a lot of transmission in the community, despite a lot of transmission in those age groups. So the work certainly doesn't go unnoticed, I'm sure by parents and Manitobans. And but we all have to continue to work hard with those fundamentals. The safeguards that are in place in schools have limited that transmission. So I think we're going to continue to follow things very closely. Contact trace. These restrictions are planned to bring down that community transmission. So we'll continue to watch things moving forward. But right now, the efforts in the schools are limiting the transmission of this virus.
From CHVN, Taylor.
Hi, good afternoon. A lot of Manitobans are going to be disappointed with these orders. How do you respond to this disappointment?
Well, I'm in the same group as them. I'm disappointed that we've had to deal with this pandemic this long, and that these restrictions are not without their challenges. And that's why we make these decisions very carefully and not without a lot of rethinking things. I think you could see by that chart that we put up at the beginning that we really have limited choice at this point. We have that risk of overwhelming our healthcare system, which means it's not only about COVID care. It's about Manitobans who need care for non-COVID reasons. We know we see significant delays in surgery because our hospitals were full of COVID. And so we're along that ways again. So we're really at this point where everyone's tired of these restrictions. This could really be our last push with vaccines rolling out, with summer on its way. But we just can't be in a position to overwhelm our healthcare system and not have that healthcare system there for all Manitobans.
I'll just pitch in, Taylor, and say, too, take a look around the world and ask yourself if you want no restrictions, if that's what the alternative is. You're saying that people will be disappointed. I think we're all disappointed to have to take a step back, but we know it's the right thing to do. It's a necessary thing to do. And we know that it's not going to be forever. But take a look at where there aren't restrictions and where they aren't being applied and where people are ignoring them if they're there. And you'll see people dying unnecessarily, and you'll see hardships of unimaginable proportions. So you're not seeing that here because of people like Dr. Roussin and the work that he's doing, and we'll continue to act on his advice in adopting restrictions that we think make sense and that strike the right balance to protect Manitobans and their health and well-being.
Thanks. And So people are saying that these orders are causing side effects in things socially, economically, with mental health. I know earlier you talked a little bit about this, Mr. Premier, but people are concerned about these kinds of things. What do you say to people who are thinking about this?
We're thinking about it every day. There's perspectives all along the continuum, from we shouldn't have any rules to we should have everybody live in bubble wrap. And, we're trying to strike the right balance here with the right kinds of restrictions, adopt at the right time to protect people in the right ways. But again, we need Manitobans to follow those restrictions. And when we see something like it happen at the Forks yesterday, you have to ask yourself what people are thinking about. That's, we have to remember that these are short-term sacrifices. There were generations of Manitobans and Canadians that made far greater sacrifices than we're being asked to make right now. I know we're in the middle of a hardship time, but others had to deal with a lot worse than this. We just are asking you to stay home in your comfortable home, we hope, safely, and protect yourself and protect each other. We're asking you to wear a mask in the appropriate circumstances. We're asking you to, when you have an outside gathering, keep it small. These are small sacrifices to make to protect the lives and well-being of your own family and friends. So it's not forever, but it's the right thing to do now, and we're asking Manitobans to abide by these rules.
Thank you.
From the Winnipeg Free Press, Carol.
Hi there. Dr. Roussin, why ban outdoor visitors at a personal residence but allow non-household members to dine together on a patio?
Yeah, so this is a lot about that messaging and a lot about where we're seeing the transmission right now. So we're seeing a lot of transmission at private gatherings, private residences. And so we really want that messaging that it should be unusual to see people visiting private residences. If we had outdoor, say 10 at private residences, it would be unusual to see 3 cars in someone's driveway because they could have 10 people in their backyard. So we really want to say the private residences, private visiting, the sort of the uncontrolled areas, that's where we're seeing the transmission. So we want people to stay home, not have any visitors over at their place right now with those rare exceptions. If you do gather with people, you're going to gather outdoors. The patios are very limited. They're also controlled. They're distanced. So, right now that's where we're focusing on is where we see a lot of the transmission, and that's in private residences.
And Premier, new federal data shows that Manitoba has only deployed 3% of its rapid tests. 97% of Manitoba's rapid tests are sitting in a stockpile. Why are we not using these to screen out COVID carriers? And is it time to just give them to another jurisdiction that can actually use them?
Every jurisdiction across Canada has got lots of the federal testing equipment and storage, Carol, but we took the step of purchasing better equipment that does a better job. And so that's why you're seeing the number low in Manitoba's column there. Our testing turnaround times have got so good now that we're actually doing more real testing instead of the rapid testing, which, as you know, is sort of a more generalized testing, more approximate testing. So we've enhanced our testing capacity. We've done it by investing tens of millions of additional dollars in higher grade, more accurate testing equipment. And that testing turnaround time and the testing performance, as well as the rapid testing that our vaccine team has implemented, our health officials have implemented with the help of frontline workers, has done, I think, an admirable job of moving us to a much improved situation. That's one of the things where I think we're in better shape than we were in the start of the second wave, not just with, I think, more people being aware of the importance of following the health rules. I think we are different people. I hope we can prove that, all of us, but also in terms of our ability to respond to testing, the tracking, and those systems that have been much improved.
From Global News, Brittany.
Good afternoon, Brittany from Global. Dr. Roussin, you've said that we haven't seen, or previously have said we haven't seen transmission happening at those restaurants and gyms, but yet these places are being asked again to bear the brunt of these lockdown restrictions. We're not seeing transmission at schools yet. We're not seeing any changes there or even an increase in how far kids have to be kept apart. Why are businesses again being asked to bear the brunt of some of these restrictions when we haven't seen the evidence that there's transmission happening there?
Yeah, well, I think we've had a number of restrictions ongoing, and that's why we're not seeing a lot of the transmission happen there. These ones that we announced today, I'm not sure I would classify it as them bearing the brunt of it. The only change for restaurants really is going down from 6 to 4 on the patio. And then in gyms, it's really just requiring that 3-meter distancing. So yes, I'm sure all along this, yes, there's been very challenging for a lot of sectors, but because of that, we've kept that transmission down. But these particular orders, I wouldn't classify the changes necessarily that way.
We have seen cases that have been because of people not isolating when they've gone out of province. How are we going to ensure that people are isolating if we're not restricting the borders and we don't have people sitting there watching who's driving in and out of the province? How are we going to ensure that people are actually following those rules?
So that's part of the step. Thanks for asking that, Brittany. That's part of the stepping up on enforcement piece, I think. The self-isolation cases and contacts issue matters. So we've asked our enforcement people to work with public health, establish some strengthened protocols to provide law enforcement support for the ticketing of breaches or of unsafe circumstances are happening as a consequence of inattentiveness, including such things as checking on contacts, personally close contacts, and so on. So it's going to be part of the additional enforcement measures that we're talking about here.
Our final reporter this afternoon from CBC National News, Cameron.
Hi, Premier. Hi, Doctor. Dr. Roussin, just to clarify, on the no indoor gathering, does that apply to indoor sports?
No, and so the indoor gathering rule is doesn't have a huge impact on because of where we are right now. There just wasn't anywhere for people to gather indoors other than what's been listed in the orders. So everything that has listing of its own in the orders, that's the capacity they follow. So the indoor gathering doesn't say apply to a retail outlet. They need to be at 25% capacity or 250 max. The indoor sports have their own capacity, which is groups of 10 in there, and now we have a new spectator rule there.
That helps. That clarifies that. Second question: going forward here over the next 4 weeks, and you're mentioning trying to save the long weekend. Do you have some, kind of lines in the sand that you're looking at here over the next couple of weeks, whether it's the test positivity rate or the ICU numbers? I know you look at all this stuff, but if we were to hit, say, 10% test positivity here in Winnipeg, would we be looking at a different regime of restrictions again?
Yeah, and sort of like you framed there, we look at a number of restrictions. So the test positivity, for sure, we're going to have to see what the hospital situation looks like and ICU numbers at that time. And then, of course, now we have an additional variable is vaccine uptake. And so all this plays together to help us determine where is that burden of illness. Are we seeing it translate into hospitalizations and ICU and increased demand on the healthcare system? So it all all play together. So moving forward, we're going to follow those real numbers, but also trends. And it's our real goal to get ahead of this, to bring down these numbers quite early, and we just might be able to save that long weekend.
We'll just close by saying thanks to everybody. Thanks again to you, Brent, Dr. Roussin and his team for their work. I also wanted to say a thank you to the Manitoba Trucking Association for their assistance in coordinating and promoting getting their long haulers to involve themselves in the vaccine uptake in North Dakota. Say thanks again to Governor Doug Burgum and the entire team down there that's assisting us with that. It's been a challenge, but we're getting it underway. And also to say to everybody, as we move these ages down and as you're able to get your vaccine, please take the first available opportunity to do so. I encourage you to do that. Our vaccine team has got a number of sites available. We're opening more in the next few days, and we're looking forward to accommodating your need to get a vaccine. You know, that way we catch up on these variants and we get ahead of them. Thanks to everybody for taking part today.